Good afternoon. Thank you for your responses today so far. With regards to the migrant crisis in New York City that we read about every day, and all these cuts to Medicaid we're talking about, can you explain to us what the impact of the migrant situation is on the Medicaid program in New York? How many of those are eligible or ineligible?
So some members who are migrants are eligible for the essential plan, and we do have assisters who actively help them get the essential plan. So we do try to enroll as many people as possible. In addition, just to highlight another issue, there is about $25 million in this budget to help with making sure people are screened for tuberculosis and get vaccines before they get insurance. That's additional money that's put forward to help to address those issues when people arrive. As far as Medicaid goes, my understanding from Medicaid is they're eligible for emergency Medicaid if they need it. You can supplement that if you need to.
Yeah, it will really depend on the individual's status, documentation status upon entry into the country. If they are undocumented, they are eligible for emergency Medicaid, which is a life-threatening or critical condition, inpatient services. And then, as Dr. McDonald said, if they do have, if they are asylees or asylee seekers and are working and have work authorization, they would be enrolled in the essential plan. So no Medicaid costs.
So, but you don't have numbers of how many migrants are enrolled in the essential plan as opposed to getting emergency Medicaid?
I don't have them in front of me, and it's a little harder to answer that than it may seem, but it's certainly something we can get back to you on in writing.
Yeah, well, with all the discussion about the financial impacts of this migrant crisis, particularly in New York City, we should have a handle on that and know what the impact, what the cost is, and really, what we should be asking federal government and President Biden to supply to New York State to cover these expenses.
And I think some of those expenses are well beyond Medicaid and costs that New York City has had to incur for other social supports and housing services.
Moving on a little bit to hospitals and Medicaid, it's been consistently reported that Medicaid is underpaying hospitals by about 30% for the cost of supplying those medical services. Do you agree with that number? And what is the state looking at doing with regards to making hospitals whole for providing those services?
I haven't looked at the numbers closely enough. I know they reference the 70%. I think that's as a percentage of their cost. We do have sort of rules, and the federal government has rules that dictates what Medicaid can reimburse hospitals for services. We are at those limits, meaning we cannot pay them anymore while continuing to receive federal financial participation on those payments, which is why you've seen such a large increase in our state-only Medicaid payments because we can't get federal match anymore. So I think there's certainly some alignment on the numbers, but we've done a number of things and invested in those reimbursement rates through state-directed payments and other payment vehicles. Unfortunately, we are just running out of options to get federal match, which is important.
Are there discussions going on with the feds to deal with that inequity?
There absolutely are. It's something we spent a considerable amount of time negotiating with them as part of our 1115 waiver. So they are agreeing to provide federal match, even though we are above those limits for those hospitals, which is not the ideal scenario, but it is an acknowledgement, I think, on their part that more needs to be done to support those institutions.
Getting back to the migrants for the last few seconds I have, what is the impact on hospitals or other healthcare providers providing services to uninsured or ineligible migrants or illegal immigrants?
I think there are, to the extent they are uninsured, they would be getting Medicaid. Undocumented, they would be getting Medicaid reimbursement. But many are eligible for the essential plan and are receiving reimbursement from the essential plan, which is higher, significantly higher than the Medicaid rate.
Thank you.